Thanks. Hi everybody, welcome to this second in our series of Health Literacy UK October Health Literacy Month little bite-size seminars. Great to see so many of you on. So today's seminar is going to be from Blythe Robertson, who is the NHS Digital Services General Manager, but we've known Blythe for quite a long time now, as it feels, as he worked with Graham Kramer in the Scottish Government in the policy, and then took over there with the health literacy kind of hat on, if you like, taking over from Graham, and then moving into his current role. So he also wrote the health literacy policy, the second policy for Scotland. So Blythe, I'm going to just turn off my video now and sit in the background here, and we'll catch up with you later on.
Great, thanks very much, Evelyn. I'm gonna share my screen and just make sure that that is all working well. So is that screen sharing working okay for people? Can you see my first slide?
Yes, if you just change it, the display settings there, Blythe.
Oh, okay. Let me see how I do that.
Yeah.
So is that now?
That's it. Yeah.
That's it.
Great.
Okay, that's brilliant. Okay, thanks very much for the introduction, Evelyn. My name is Blythe Robertson. I work at the NHS Digital Service, but in a prior incarnation, I was the policy lead for health literacy at the Scottish Government. As Evelyn says, I had responsibility for production of the second health literacy action plan in Scotland, making it easier. I suppose part of that action plan included a small mention around digital literacy and the potential complex interplay between digital and health literacy. And that's really going to be the focus of my contribution today. I will say that when I was writing that part of the action plan, I was mindful that I was soon to be leaving the organisation, and I recognised that this was a really complex area, and I hoped somebody would come along and take up the cudgel on this and perhaps come up with some new and innovative approaches to address some of these challenges. So having left Scottish Government, it was entertaining to come back into the world of work in a different role, working for NHS Education for Scotland, but really cast with the challenge of addressing this complex interplay between health and digital literacy. So I only have myself to thank for this, which is a joyful place to be in, I suppose. So to give a bit of background, this is all about. So in 2018, government published the Digital Health and Care Strategy, which amongst other things sets out the ambition to address the fragmentation of health and care digital services through something called a national digital platform. And to summarize what a national digital platform might be and what that might mean, it's about getting the right information to the right people at the right time at the point of care. It's about development of a common architecture to allow for innovation. So what that means is, while we might be tasked within our team to create the national digital platform, all of the services and applications and apps that might be needed to manage all of the various strands of health and care business, we can't build all of that. We can build some of it, but we're reliant on creating the conditions for innovative approaches to emerge using some of the common componentry and standards that we will develop. And once we have this common infrastructure in place, that will allow us to start looking at things at a Scottish population scale, which creates interesting opportunities for research and interesting opportunities for quality improvement. So the NHS Digital Service that's been tasked with putting this together it comprises some of these people summarized in this slide. It's a really interesting place to work. It's a cross-functional team We have software engineers, we have product managers, we have clinicians, we have people doing the sort of stitching together of the stuff and things, which is kind of my role. We have people with equalities as part of their focus. And it's a really interesting, dynamic, multi-perspective team that's been put together to make this a reality. And I suppose my role is looking at things around digital health and health inequalities, coming back to that interplay that I'd set out as a challenge within making it easier, the Health Literacy Action Plan. And one of the touchstones that we had, both in the creation of the first plan, making it easier, and then the second plan, was this idea, which in my current digital context is a very apt metaphor. So part of the general thrust around the health literacy work in Scotland has been, embracing this challenge, I suppose. So if you have the question around how do you improve people's computer literacy, and for those who are younger on the call, this is what a computer used to look like. So it was a big beast of a thing. And the way that you interacted with it was typically through knowing complex instructions that you would then input to the machine to enable it to behave in a range of ways. It required expert level knowledge. It required often, very, very in-depth and granular appreciation of computing languages. And when the challenge was to spread out computer literacy beyond the realm of the experts, the industry could have gone one of two ways. It could have promoted this idea of building increasingly in-depth experts, or it could have done what it did do, which was this. It made the interface rather more easy to interact with. So the person who's playing with this iPad here does not have his PhD, as far as I understand it. The way of interacting with computers just became so much more straightforward. And this was emblematic of the shift we were looking to enact in Scotland around recognizing that health and care systems were typically very, very difficult to understand. And this was often the creation of the system itself. And the way to do that, the way to address that, and the way to simplify that challenge wasn't necessarily by making people understand the system better. It was about making the system more simple to interact with. And, as I say, this was a real touchstone for us when developing our initial thinking around health literacy in Scotland. And this, within the context of digital and how we develop and design digital systems, has a really strong coherence with this. Which is a summary of what we call the Scottish approach to service design. So this is articulating the design challenge it's fairly, what it's trying to illustrate is the kind of the two-stage approach, the emphasis on discovery and definition rather than jumping to solution development. And this is a common approach to design, a common set of design principles that's been given an articulation in Scotland as the Scottish approach to service design. And this encapsulates lots of elements of health literacy, but takes it beyond, I suppose, the regular scope of health literacy. So what we might think about health literacy as, encompassing a sort of general definition around skills, confidence, knowledge, and understanding. We've definitely seen aspects where this has been broadened out to how we look at the design of services. And that, I suppose that was a sort of long-held ambition in Scotland for how we extend the bounds and scope of health literacy to encompass this design of health services work slightly more in slightly more detail, or slightly more collaboratively, I suppose. And this idea of service design is, it applies to lots of aspects. It's not just a health and care thing. It relates to, certainly in the bounds of the Scottish approach, across all public services, but it relates to just how we design systems and services across all aspects of life. So, the work of digital health literacy has found a real coherence with this work within our team on how we approach the design and delivery of digital services. And I suppose following on from that and leading into work that I've been more directly involved with has been this idea of barriers to access. This is work that's been collaboratively developed with the Government Digital Service UK and Westminster level, and various collaborators, including our team here in Edinburgh. And what this starts to articulate is, again, some of the challenges around how you develop and deliver services, in our context, digital services, that relate to, some of the challenges of health literacy that you might, identify with around things like interface and interaction skills or comprehension skills, but set it in this wider context and explore some other themes that are quite often understood to be barriers, things like people's emotional state or people's general enthusiasm to interact, and then get into bigger, I suppose, societal issues around trust and how you build trust in particular services and particular contexts. So we found this a really useful way of articulating both our challenges in terms of meeting the needs of a diverse population, but also kind of articulating the interrelationship between, I suppose, health and digital literacy and this wider challenge of how we design services. So this is that bit is, I suppose, the theoretical of where we're at. We were sort of tootling along, applying some of this thinking to our strategic context around things like care planning and how we might define services and information services to support people living with cancer as sort of strategic priorities for the national digital platform. But then the pandemic arrived and sort of delivered a bit of a change of pace, I suppose might be the apt euphemism. And during that period, since I suppose the end of March, we've been asked as a digital service to focus on some different things. And for me personally, it's involved going beyond the sort of theoretical consideration of these to getting my sleeves rolled up and involved in service delivery in a much more direct way. So the service on which I work most directly was something that we spun up very quickly, which we call the SMS shielding service. So this was to support people on the shielding list. So in the Scottish context, that's about 180,000 people who were advised to stay at home at the start of the pandemic period because they were the people at most risk of serious implication if they caught coronavirus. And what we spun up to support those people was a service that would deliver food boxes, would connect them to medicines delivery, would allow them to access supermarket delivery slots and things like that. And when we were defining the service from the outset, we thought about health literacy. We thought about how we would best design the service, and we thought about the relative digital skills of people and their ability to interact with this kind of service. So accordingly, we chose a technology in SMS that was probably certainly not the most innovative way of doing things, but recognizing that the population that we were going to be working with likely had a representative or slightly lower level of relative digital skills. We had to deliver a technology and a solution that was going to meet the needs of that population. So a technology decision point and diversity of the population, it was informed by digital health literacy. And essentially, we didn't build an app. We put in place a text message service because it was much more likely to connect to the population that we were working with. Over the course of that service, we got about 118,000 people out of the 180 signed up using the service. So the uptake of the service was 60% and above. which I'm not sure what we would have set as our expectation or ambition or goal around this, but that feels like a very high uptake of the service. And again, part of the reason that I was appended to the project directly was to make sure that when we were sending out these messages, they met readability standards and they were as clear as they possibly could be. At one point, we got feedback that the tone of the messages felt like being communicated with by the Soviet state, I think the term was. And curiously, I took that as something of a compliment, because I think what they were meaning was that the messages were very direct, they were quite sparse, and they were to the point. I suppose in reaction to that feedback, we developed a little bit more warmth into the way that the messages worked, in that we developed a few thank you messages. So if you interacted with our service and said thank you, which a lot of people were doing, we could program our little bot to go back and say you're welcome, or something with just a degree more warmth rather than the sparse functionalism that I think we've been criticized for. But as I say, that was the type of clarity of communication that in some ways we were aiming for. So this was an incredibly in-depth and positive experience, all informed from a digital health literacy point of view. And across the bounds of the service, we delivered just short of 1 million food boxes to people. We've sent up, that figure's now a few weeks old, and I think we've sent probably nearer to 2 million messages across the service. And interestingly, because we looked at the potential equalities impact of the service, and then ran the service over the bounds of the last few months, and then paused the service at the point at which shielding was moved away from, we can now mark our own homework on this. So we can see what the experience of using the service was like, whether the impacts that we predicted actually came to pass. So our task at the moment is sort of examining the evidence for particular uptake of the service across like the age of the age diversity. So we might expect that there would be a drop off of people above the age of 65 in terms of engaging with the service digitally. But is that evidenced by what we saw in terms of sign up? So we have work in progress to look at that, and it's a really good sample size. It's going to give us some really interesting and meaningful stuff to share. So we're looking forward to getting into that over the next few weeks. We've also been involved, although I've been slightly less directly involved, in the Protect Scotland app, so the proximity app and the versions of that that are in play across UK administrations. We took the decision to go with the good work that had been going on in Republic of Ireland and then Northern Ireland, so building upon the experience that we had there. But I suppose what I will say is, again, this work was fairly rigorously equalities impact assessed at the start, and it was interesting to see within the bounds of that. And whilst I was involved in this work, this isn't me shoehorning words into this from my own agenda. This was picked up as part of the overall assessment to recognise this idea that the burden is on the health and care system to be as clear as possible, rather than leaving it for people to jump over the hurdle, I suppose, to hark back to another metaphor that we often use in this area. And then I suppose it's important to say, in the context of what we're doing here, that whilst we have responsibility around thinking about some of this stuff from a digital perspective, and particularly in the context of the Protect Scotland app, this is just one part of the solution. And this, I found quite an interesting analysis of the role that digital can play in, taking on some of the burden and allowing the more paper-driven or more human-driven processes that are really the cornerstone of test and protect type approaches. It can allow them to get on with the more complex cases by addressing some of the more straightforward stuff and delivering some process efficiency for the more routine cases. So it's interesting to think about the role that digital can play and how delivering successful digital solutions can influence the other things that sit around. This is often a question that we wrestle with in terms of our delivery, and our responsibility, I suppose, is around the digital product and getting them as good as possible. But when we have that, how do we effectively influence the other parts of the system to make sure that digital isn't unduly racing ahead and creating further inequalities that the implementation of digital systems has been quite bad at historically. Digital has been shown to widen inequalities in many circumstances. So how do we work against this, or how do we work to address that gap, and how do we reduce that gap through the effective implementation of digital services? I suppose just to say a kind of final word on the National Digital Platform and kind of conclude with a little call to action. Hopefully this has kind of illustrated that some of the stuff that we're working on here is quite complicated. And when we're talking about designing services to meet the needs of a diverse population, to meet a range of different digital and health literacy levels, this needs to be much more of a collaborative effort. So I like this kind of quote from Phillips in this good book, which I would recommend, The Future of Feeling, how we build kind technology. One of our other touchstones around what we're doing is this idea of how we make digital interactions make you feel cared for in the way that face-to-face interactions do. So the challenge that we have in creating these services is one that we need help with, and one that we need lots of perspectives on. And it's why events like this are really, it's a real privilege to be invited to come and speak at this, because we need to be collectively thinking about this, and we need to work together to deliver these types of solutions, because the opportunity is really there to do it. And if we think about it from a design perspective, from a health literacy responsive perspective, we have an opportunity to build digital solutions that can be responsive to the diverse needs of the population. So I will say thank you at that point and pause for any questions and things like that.
Hi, Blythe. That was really great, and something that I've been quite interested in hearing from you about, especially over the last 6 or 8 months with these rapid responses that you've had to make. Sorry, I'm being called on another call, so I'm trying to get rid of that. Sorry about that. Here's a multiple iPads and laptops, etc. But yeah, really interesting as well how you said there that you had to build in that response. With any AI, there is still an element of humanizing it, and there is people still tend to talk to, like Siri or whatever, as if they are a person. That's just kind of inbuilt in us. So that was an interesting concept beyond, just the thinking about how you make sure the message in itself is direct and straight to the point, and how the tech reaches as many people as possible. So, Anne, could you explain how we're doing the Q&A? That'll be good.
Thanks, Evelyn. So if anyone has a question, they can just submit it into the Q&A box, and then we can answer them as they come in. I don't see any in at the minute.
And just to say, that box is just down the bottom. If you hover over, it's the second one in after participants. Mm-hmm. So you should be able to see them in there as well. Blythe?
Yeah, I can't see it. Can't see anything as yet. Oh. Hi, Werner.
I suppose I have a question, Blythe. In terms of the shielding service, the SMS text message service that was developed. Is there any way of learning from that for future services to interact with people that may be vulnerable or feeling isolated, even in the next couple of weeks, to provide social support, or to, I suppose, to really expand on what has been learnt during this period that could be developed further?
Yeah, I think there's heaps of good learning. I suppose one thing that I missed out from the bit on shielding is that we did put in place alternative routes for people to interact with the service. So we had a route where people could pick up the phone and interact with the service as well. And that was important in capturing the people who didn't feel comfortable interacting or couldn't, for one reason or another, interact via the SMS service. So that is an important thing to say. And interestingly, we started to see evidence of the population that had mobile phones, but maybe didn't have internet access that was included within that. So the historic users of Nokia 3310s, I suppose you might call them, and that again is interesting in seeing, you know, people that have mobile technology but not web technology, or like using a mobile phone, don't like using the web so much. And we just start to have, you know, really rich and interesting data to analyze around that. So there's heaps of good learning. I would signpost you to the Equalities Impact Assessment that we did on the service that we published relatively recently, but I need to check with our web team because I can't find the link for that. But I will send it on to people, because that kind of encapsulates some of the learning. And then, as I say, this results piece around did the predicted impacts actually take place is work in progress, and something we hope to have at least something like a blog post type content on that in the next little while.
Looks like there's 6 questions there. Great.
Okay. How do we assess emotional well-being in digital? Oof, that's a good question. I might come back to that. I might have a little think and move on to another one. If you would redesign such a service again, what would you do differently? That's a good question. I think there are some boring answers around that, around how we manage the data. That would definitely be a key piece of learning, because the management of that amount of data coming at us from various different angles, and the different things that we had to do with it, whether it was delivering, you know, food parcels directly to people or connecting them to supermarket services. There were a number of data challenges that could definitely have improved if we'd taken a bit longer to think about some of the design challenges around that. I think involving a few more people in those design conversations as well, people that were likely to be using the service, would have been rather better as well. But we were rather challenged for time on that. But that would definitely be a key learning to come back to. Let me know a little about the work on universal barriers. So I think we should have something that goes into a bit more detail on the barriers in terms of blog content in the next couple of weeks. So happy to share links on that once we have that. Essentially, it's looking to allow us to give a more thoroughgoing exploration of a range of different challenges, and the reality of the range of different challenges that people experience when interacting with services. So we're really keen to get more perspectives on that, and so happy to share content on that once we have something a bit more shareable. I can obviously share these slides, and you can get to pick through the detail of the particular barriers in a bit more detail, and happy to pick up a conversation on that as well. What was the service for ordering? What's the service just for ordering groceries, etc.? So the service covered. So the main bulk of the service was connecting people to food and parcel delivery. to support them at a time when we were asking them to stay home and connecting them to services to deliver food was very difficult. So government took the decision to make food parcel delivery available, and we were coordinating the logistics around that. There were obviously, as the service moved on, and we worked with the supermarkets to connect people to supermarket priority delivery slots. We also connected to, rather than coordinating necessarily medications delivery, we connected people to services that were going to do that. And then I suppose the other strand around that was that we kept people up to date with information. So the service, whilst shielding has paused since the start of August, we've been keeping people up to date with messages relating to local lockdowns and changes in advice to people, and so the service is still very much in live use, and we were sending out messages, and we're working on messages pretty much day to day. Any tips for writing app informational content in an accessible way? Let me have a think about that, and I'll come back to the other one around emotional. When considering digital health literacy, how do you view the interaction? Yeah, that's the heart of the matter there from Ronnie. How did you ensure that your messages were culturally appropriate to the diverse population? Yeah. So I suppose, right, I'll take the last one as well. I think the drafting of the messages themselves just had to factor in lots of different perspectives. So at a basic level, we would do readability checks to make sure that the language was clear and sparse and to the point. We definitely had some challenges around terminology that needed to be responsive to a range of different cultural needs. I think we just tried to think of as many different angles as we could. Obviously, our initial work to Equality's impact assess the service provided us with a good steer on the types of challenges that we were going to run into. And I suppose that just gave us the basis for the types of checks and the way that we approached each of the messages from a drafting point of view. So hopefully that covers that one. The interaction between digital skills and health literacy is a really complex area. There aren't simple answers around this. There's a really interesting paper that a colleague in Denmark, Christina Sorensen, wrote. That it might be useful to share the link on that, which says that it kind of outlines how digital services have been quite poor in terms of their propensity to widen health inequalities. And Christina proposes that approaching the design and delivery of digital services from a health literacy point of view is likely to be successful in those services being responsive to a range of needs and addressing that sort of interplay between digital and health literacy. But it's a very complex area. That's one sort of flavor of answer, but there's an awful lot of ground to explore between it. But the work in creating the national digital platform is exactly the type of setting, the type of use case in which to explore that in a lot of good and useful detail, I think. Any tips for providing app informational content in an accessible way? So I think, some of this can come down to very, simple tricks around readability. Readability, it can be quite a complex area. It's not just a case of using short words and short sentences. It can be about, again, like responding to the cultural diversity of your population. But I found some very simple tools, things like Hemingway, which is a little online utility that you can draft your messages in, and it will tell you your relative readability scores, and it will bark at you if you make your sentences a bit too long and things like that. And I think that can be impactful, just getting the basic readability of the messages to be as good as it can be. And I found Hemingway to be a useful tool for that. Other tools are definitely available though. How do we capture feedback about the service? Okay, so our colleagues in Public Health Scotland ran an online survey. So one of the messages that we sent out was to signpost the population and the people signed up for the SMS service to this online survey. And out of the about 100,000 people that we had signed up for the service at that point, about 10,000 people gave a response to Public Health Scotland's call for feedback. I can certainly link you in to the findings of that, because that's got lots of interesting whatnots about the shielding experience more general, and certainly some stuff about the experience of the SMS service. So I think the only one that I've got to come back to is how we assess emotional well-being in digital settings and digital sessions. And I've been pondering that while I've been answering the other questions, and I'm not sure I've got a very good answer for it. But I think the principles of service design and the principles of collaborative design is that you're designing services to be as responsive to people's needs as they could and should be. So I think we just need to maybe factor that in as another angle and aspect that we're thinking about when designing services. And I guess it's being responsive to feedback and evaluation around those things as well. But that feels like an answer. It doesn't feel like a super comprehensive answer. And I think that's one that I might go away and think about a bit more, because that feels like an interesting area for further exploration. So that's a great question.
That is a great question, and it's an interesting one that comes back a wee bit to being responsive, I suppose, in the AI in a way.
Yeah. Did I get all the questions, maybe, Evelyn?
Yeah, I think you've got them all.
Okay.
And that idea that even places like Google realise that you need that multidisciplinary team, and that team can often require psychologists, sociologists as well, for those types of messages. You're also, I suppose, in this case, reaching out at a very emotional and high anxiety time as well, which is unprecedented, I suppose.
Yeah, absolutely. I see there's just a follow-on comment there saying track and trace, phone call inquiries, follow up on emotional well-being. Yeah. So that's another way of ensuring that. But capturing that information in a sort of good and systematic and reusable way, I think is an interesting area to explore as well.
Okay, I'm not sure if we've got any more questions here for Blythe. So if not, and we've recorded this session, we'll put it onto our YouTube, and you can follow us at Literacy Health, which will allow you to know when that is available. That panelist hand is mine, so you can ignore that. And once again, Blythe, just to say thank you for undertaking this seminar for us, and thank you to the participants. Great questions, and great to see folk logging in. Thanks so much.
Thanks very much, everyone. That was really good.